Walk for your well-being. Why you should love the 6-minute walk test. Brought to you by the PAH Initiative and sponsored by United Therapeutics. Congratulations on your interest in learning all you can about pulmonary arterial hypertension, or PAH. You probably dislike the 6-minute walk test, but did you know that it's actually a very important test that tells your healthcare provider a lot about your PAH? In fact, recent studies tell us that out of all the tests your healthcare provider performs, the 6-minute walk test is the best predictor of how you will be doing over the next 5 years. Let's explore the reasons to love the 6-minute walk test. This video will help you learn about the 6-minute walk test. You'll learn why it's an important test and how it can help you, what your 6-minute walk distance can tell you and your healthcare provider, and how you can use your 6-minute walk distance to partner with your healthcare provider to create a treatment plan that is right for you. First, let's learn why the walk test is important. The 6-minute walk test measures the distance that you can walk on a flat surface in 6 minutes. You may wonder how this relates to your daily activities. Actually, the 6-minute walk test tells your healthcare provider a lot. It provides clues about how your heart, lungs, and blood vessels are doing today. Hopefully, today you are feeling better than you did before you were diagnosed. Maybe you're having more good days, and you're able to do more than you could before your diagnosis. Yet, you still may have symptoms. You would like to have more good days, and you'd like to do more. Make plans. Do the things you enjoy doing. The 6-minute walk test is one important piece of information that your healthcare provider can use to help shape your treatment plan, adjust your medications, and help improve your symptoms. Repeating the 6-minute walk test at every office visit can tell your healthcare provider how your heart, lungs, and blood vessels are changing over time. When you're able to walk farther than you did at your last appointment, your PAH may be getting better. But if you walk the same or a shorter distance, it could be a sign that your PAH has gotten worse or isn't as good as it could be. In that situation, your healthcare provider may consider changes to your treatment plan. This may include adjusting your medication or possibly adding medication. Your healthcare provider may ask you to complete a 6-minute walk test every 3 to 6 months. The 6-minute walk is one of several tests they look at and evaluate when doing a risk assessment. Once they look at all of your results and information together, your healthcare provider will determine your risk status and likely discuss it with you. So, what does your risk status tell you? Risk status uses information about your disease today to help predict how you'll be doing in the future. In fact, in PAH, risk status helps predict survival over the next 5 years. There are 3 risk status levels, or categories: low risk, intermediate risk, and high risk. Low risk means that there is a better chance of survival over the next 5 years. Intermediate and high risk mean that there is a lower chance of survival over the next 5 years. The goal for many patients is low-risk status. This goal is supported by PAH experts and PAH treatment guidelines. Achieving low-risk status may not be possible for every patient. Whether low risk is possible or not, each patient's care should be managed with the goal of achieving a lower risk status. It's probably hard to believe that the 6-minute walk test is an important predictor of survival, but it is, and here's why. In 2 studies that looked at thousands of patients in 10 countries, the 6-minute walk test was the best predictor of how you will be doing over the next 5 years. So, how far you walk today helps your healthcare provider predict how you may be doing in the future. If you walk longer distances today, your chances of doing well in the long term are better. We've learned how your healthcare provider uses the information from the 6-minute walk and why it's important. Let's take a look at 6-minute walk goals and how they are determined. So, how far is far enough? In the 6-minute walk test, the average patient with PAH can walk about 350 meters. That's a little less than 400 yards, or the length of about 4 football fields. That's the average, though. Some people walk a shorter distance, others walk farther. So, what's the right goal for you? Each person is different, so each person will have a different goal. There may be several reasons why you can or cannot walk the average distance in 6 minutes. You may have physical limitations or conditions that keep you from walking more than 350 meters. Talk with your healthcare provider to see what distance is the right goal for you. For many of their patients, PAH experts set a goal of improving walk distance over time. That's what's important, trying to improve your walk distance. If you are not reaching your goal today, you can work with your healthcare provider to meet your goal. PAH medications are based around 3 substances produced by the lungs. Nitric oxide helps keep blood vessels open. Endothelin makes blood vessels contract or become narrow. Prostacyclin helps keep blood vessels open, prevents clotting, and slows the thickening of blood vessels. You can have 1, 2, or all 3 substances out of balance, but there is no test that can determine which of the substances need to be corrected. There are 3 classes of PAH medications, and each class works on one substance or pathway to help bring levels of each substance back to normal. In other words, there are 3 different ways you can treat your PAH with medication. Most patients need more than one class of medication to treat their PAH. If you are not reaching your goal in the 6-minute walk test, your healthcare provider may be able to adjust your treatment regimen to help improve your 6-minute walk distance. Now you know why your 6-minute walk test is important. Let's look at what to expect at your next appointment and how you can partner with your healthcare provider to set goals and create a treatment plan that's right for you. Many PAH healthcare providers will assess how their patients are doing every 3 to 6 months. That means you need to be prepared to perform the 6-minute walk test at least twice per year. Each time you perform a 6-minute walk test, you can expect to walk continuously for 6 minutes, only slowing down or stopping to rest, and to possibly experience shortness of breath or fatigue. Here are some tips to remember when completing your 6-minute walk test. Remember that it's how far you can go, not how fast. You may need to use oxygen during your 6-minute walk test, and that's okay. You may use your usual walking aid, like a cane or walker if needed. Be prepared to walk. Wear comfortable shoes and clothing. Be proactive in tackling your PAH. Keep track of your 6-minute walk distances at each appointment so that you can monitor your progress over time. Keep a log of your daily physical activity so you can track your activity level to see if it is increasing or decreasing. You can share this information with your healthcare provider. At your appointments, don't be afraid to ask questions like, what is my 6-minute walk distance? What distance is the right goal for me? Is my 6-minute walk distance improving? What more can I do to improve my 6-minute walk distance? Make a list of activities that you would like to do and see if they align with your healthcare provider's goals for you. Talking to your healthcare provider about your 6-minute walk test is a starting point for setting goals and creating a treatment plan that is right for you. If you have questions, take a moment to write them down so you remember to ask your healthcare provider at your next appointment. You can visit www.pahinitiative.com for more information. Sign up to get a 6-minute walk tracker and a phone carry bag.